Hello, hello. Here we are with Volkmer's Chapter 12 called Dealing with Seizures. This is probably going to be a record timing of a lecture. It's a really short chapter with brief information that I think is relevant to all of us. Anyway, here's Chapter 12. It's seizures, and essentially, definition is a sudden change in behavior, consciousness, or a sensation caused by change in brain activity, caused by uncontrolled and sudden episodes of abnormal electrical activity in the brain. The statistic to me was interesting. About 5% of all children experience a seizure by 15 years of age. I know you're all familiar now that my son has a peanut allergy, but apparently 5% of the population are allergic to peanuts right now, and that's a lot. And so when I read how many children experienced a seizure, and it was the same, I was worried. But I guess if there's good news that can be taken from that is that half of that 5% is associated with high fevers. And so those are type of seizures that may occur when there's a really high fever and they don't reoccur. Usually happens when children are young, like under age 6, and so it's not a chronic condition. It's not epilepsy. A small number do develop into epilepsy, and there's been a little bit of research, and that chapter has a couple good graphs if you want to take a peek at them, and just shows how they've tried to see how much of the population that have a diagnosis of autism also have epilepsy, and it's anywhere from 0 to 26%. A lot of that has to do with we have changed the way we define autism spectrum disorders, and so it's kind of fogged up the data analysis and that sort of thing. But we do know that individuals on the spectrum do experience more seizures than the general population. So it goes into kind of, essentially there's these two main types of seizures. Generalized seizures, they involve the entire brain from the beginning of the seizure. So from the onset of the seizure, the whole brain is affected when this is occurring. It accounts for 40% of the type of seizures that occur in the general population, and about 70 to 75% in the autism population. So if an individual on the spectrum has seizures, then about 70-75% of those individuals will have this type, the generalized seizure. Generalized seizure used to be called grand mal, and I think people are familiar with that term. Actually, the next slide explains what each of these are, so I won't go into that now. But essentially, the generalized seizures, there's the tonic-clonic is the one that is really associated with grand mal. Absence, atonic, akinetic seizures, and partial seizures involve two types: a simple partial, which then there are 3 subcategories of those, and then complex partial, and there are 2 categories of those. Then there are partial seizures, and the difference between partial and generalized is that when the seizure begins to occur, it originates in one part of the brain and may or may not spread to the entire brain. So that's the difference. So yeah, generalized tonic-clonic, what people typically think of, this is what you see on TV and reading books and that sort of thing, affects the whole body. There's no warning. Person falls to the floor, loses consciousness. Muscles contract and relax, and the body stiffens and that sort of thing. So that's typically what's involved in the tonic-clonic. Absence is really important. This is the only type that I have seen in all the children that I've worked with on the spectrum. Luckily I haven't been involved in, having to work with having to witness, generalized tonic-clonic type of seizures, but the absence I have, and they're so subtle they can be missed, and so it's really important to think about them and be aware of them and know that they do occur. It's basically a very brief loss of consciousness, and the couple of individuals that I worked with, essentially it just looked like they were staring off into space for a few seconds. But what was actually happening is they were having a seizure. And so, of course, when you're talking about the autism population, sometimes they do stare off into space. And so it can be a little bit confusing and hard to identify and that sort of thing, but it's an important one to think about. So they might be staring, there might be some eye fluttering, there may be mild face twitching or eye blinking. There's really no warning signs, and yeah, it's subtle. And so it kind of looks like someone's tuning in and tuning out. So that's something I think to be especially aware of, because it may be really affecting. Sometimes these happen, they can be really, really brief, but they may happen constantly throughout the day. And so obviously that's affecting learning and in the individual and that sort of thing. So myoclonic seizures, basically there's a jerking of the muscles, and so if the legs jerk, then an individual might fall down. The atonic, there's a loss of muscle tone, so an individual might fall down, but essentially they're collapsing. Their muscles aren't jerking, they're just losing all tone. The partial seizures, they really vary, and so we won't go into much detail here, but essentially the difference in terms of simple and complex. The simple is consciousness is impaired but not lost, and in complex, consciousness is lost. And really it really varies in terms of the outward symptoms that you would see. The simple, because it's affecting, depending on the part of the brain that it's affecting, will affect what types of symptoms that you see. So complex, a lot of times the person seems very confused and disoriented and maybe have the appearance of being drugged or drunk. Sometimes there's lip smacking, so it looks a lot different than simple, but it varies among the individual. Now, oftentimes, the individual will have the same symptoms, but across individuals, it varies. The febrile seizures, those are the fever-related ones that happen to young children when there's a high fever, and typically these would not return. So essentially, your book wants to talk about if you are observing a seizure. Their recommendation is it's better to be a good, careful observer than attempt to be a doctor. And essentially the most important part is if you can remain calm enough to be able to note what's taking place, so that afterwards you can describe all the aspects. What the child was doing before the seizure, during the seizure, how long it lasted, what happened afterwards, all the kind of details. The text talks a little bit about diagnosing the different types of seizures, and there are many different types, and it is very important to identify which type because they're all treated differently. And so this is really critical information for anyone to have, parents or doctors and neurologists and that sort of thing. So it does talk a little bit about the typical clonic-tonic seizure of you don't do what you typically see on TV or hear about. You don't restrain the person. You don't stick anything in their mouth. They don't actually swallow their tongue, that sort of thing. So you just clear the way so that they don't hurt themselves. They don't knock into a table that then, knocks the printer onto the person or something like that. So it gives a little bit of information, but really you clear the area, stay calm, and try to get as much information as you can possibly get that can be used later. for treatment. And so the treatment of seizures, really the number one treatment across all boards are drugs. There's a lot of different drugs, and the book actually goes into detail about all the different types of drugs. And that would be really helpful for someone that, like a parent that actually is making decisions about drug treatment and that sort of thing, because it talks about, side effects and benefits and all that sort of thing. So that's in there for whoever might need it, but I didn't think it was necessary to go into the details about the types of drugs that are used for treatment of seizures. Sometimes when it has been shown that drug treatment is not effective, and drug treatment, just not even just with seizures, but when you're dealing with any kind of drug intervention, it takes a while to get it right, and a lot of things affect it. Weight gain and weight loss and growth spurts and all sorts of things affect the dosage, and it takes a while to figure out the dosage and get it right and all that sort of thing. So it can be quite a journey, and there is always the consideration of the risk to benefit factor in terms of, is it worth all the risks of the drugs, all the side effects of the drugs? Make sure that the benefit of the drugs in terms of reducing or eliminating seizures outweighs all those risks. So some of that information is in your text. But anyway, if a lot of that has been worked out and figured out and tried and attempted and it's still not controlling seizures, there is a special dietary treatment. Apparently, a long time ago, people found out that they could control seizures by fasting. Now we know that it has something to do with essentially having high-fat diets and really no sugars and starches, and you can control seizures that way, but it's very restrictive and very specific and has to be highly supervised and that sort of thing. So it's not typically a first choice. And then when all else fails, there is a surgery that is available, and depending on the seizure and where it is and why it's occurring and all that sort of thing, surgery depends. But it's pretty intrusive and it's typically not done. The last thing that your text just talks about is really the continuous care, making sure that if someone is experiencing seizures, that they're periodically being checked up on and seeing the doctor and making sure that drugs and dosage and all that sort of thing is being closely monitored and adjusted as needed and that sort of thing. Now, did I tell you or what? That's all that's in the chapter, and we only had one chapter this week, so it'll be a nice little break for you. I will give you more information on the announcements, but essentially, if you're listening to this, I might as well tell you now that there's no participation for this week. So I'm going to give everyone full credit as long as you go in. I'm going to post a discussion forum, and all you need to do is write your name or say hi, tell me something interesting that happened this week, whatever you want. But your name will be associated with it when you do that. And as long as you do that, then I'll go ahead and give you the points. So, yeah, that's it. Have a good week, guys. Hopefully you get a little bit of a break from all the work that you did this week. So, okay, thanks.